Hello everyone, I am back with the continuation of the same topic. So today we are diving into shoulder injuries, as you can read in the slide, understanding common shoulder injuries. So something you will see a lot in clinicals, sport fields and everyday practices. Okay, the shoulder is our most flexible joint, as we know, like a gymnast doing cartwheels, but that wild mobility makes it a drama queen, prone to problems from its complex cast of bones, okay, and muscles, tendons, and ligaments, all trying to steal the show. So, today we will understand about the common shoulder injuries. As I have told you, these are very basic shoulder injuries. Further, we will just see what we can go deeply, and I would explain if you want something in specific. So let's go to the common introduction. Okay, so introduction to common shoulder injuries. Okay, so as you can see, understanding common shoulder injuries is a crucial, as they can be significantly affect daily activities like lifting, carrying weight, even waving to your friend. As I have told you before, being aware of these injuries enables individual to take preventive measures and seek timely treatment, which is very essential. So now we will move forward with types of common shoulder injuries, as I will explain you 5 common shoulder injuries. I have explained in little deep and in a common layman term, as you can understand, so that it will be very easy for you. Okay, now before going to particular shoulder injuries, I would like to tell you top common injuries, that is rotator cuff tear, shoulder impingement and dislocation. These are few injuries which we commonly see in our clinical practices. Okay, so before going to that, why they happen, I would like to explain it in a little form. Okay, why do they happen? Acute hits from the sports, crashes or slips. Okay, while chronic ones sneak up from repetitive stress, slouchy posture or age. Okay, like your shoulder whispering, I have had enough. Okay, after years of desk marathons, overhead athletes or lifters, they are VIPs on this risk list. Is it fine? So the common injuries, because it happens because of repetitive trauma to the particular area or something which you are overdoing it. Okay, lifting continuously for a long time, for years. Okay, doing a particular job which includes your shoulder joint. So now we will go forward. Okay, we'll go deeper into some common shoulder injuries with clear details and how they happen, what damage occurs, affected muscles or structures and the root causes. We'll use simple analogs and step-by-step breakdown so you can picture it. Okay, as you are a medical student, so you can imagine it. Okay, like troubleshooting a glitchy machine in your future clinics. Okay, the shoulders ball and socket setup, humerus head in the scapula's glenoid, stabilized by the rotator cuff muscle and the labrum, gives amazing mobility but invites chaos from trauma or overuse. So now we'll move forward with the first common injury, that is the rotator cuff injury. So as I have given you the picture, as you can see the picture towards your right side over here. Okay, now so I'll just give you a brief explanation of that, and I'll just show you the picture, and I'll just show you the tear, what has happened and what happens in rotator cuff. So now how it happens. Okay, we'll start with that. Repetitive overhead actions like swimming, strokes or painting the ceilings, or doing carrying heavy weight, like the laborers do carry heavy weights on their head. So because of that, which gives a weigh down tendon over time. Okay, or a sudden fall onto an outstretched arm, causes an acute rip, partial, we call it as frayed edges, or full complete detachment. As I'll show you in that picture, as you can see, a partial tear or a full tear. Is it fine? So as you can see here, the partial tendon tear over here. Fine, it is with a bone. The tendon is away with a part of a bone. Is it fine? So now we'll use as I have told you, partial and complete. So what happens after that? The shoulder loses power for everyday lifts, develops a painful arc, pain between 60 to 120 degrees, abduction. I'll show you that in further pictures. Okay. Night pain wakes you. Okay. And weakness creeps in, risking further tears if ignored. Sleeping on the same side may cause you pain, which will aggravate. So there is a disturbance of sleep. Fine. Okay. The muscles affecting in rotator cuff injuries are all the 4 rotator cuff muscles. Supraspinatus starts abduction, infraspinatus and teres minor, which gives external rotation, subscapularis, which gives internal rotation. Their tendon tear, destabilizing the humeral head. Is it fine? Okay. The causes, main causes for rotator cuff injuries are overuse in athletes, as we can see in throwing, batting, overhead injuries are commonly seen in athletes. Age-related degeneration, tendon dry out after 40. Now it is early, as we can see. Poor posture or compressing the space. Okay, doing the activity continuously, which gives a poor posture, which compresses the space created. Is it fine? As I have put a picture over the right side where you can see a complete tear and a partial tear, in which even a part of a bone is also taken off. Is it fine? I am giving very simple explanation. It is not in deep. If you want me to explain it in deep, I'll just give it in the other video. Is it fine? So next we'll go to shoulder dislocation. As you can see, shoulder dislocation. Okay, how it happens, we'll go. I'll just explain you the picture which I have just put to your right side. How it happens? High impact trauma like a football tackle or bike crash forces the humeral head out of the glenoid socket, usually forward, that is anterior. 95% of the cases you can see anterior dislocation, or downward, that is inferior dislocation. Is it fine? What happens after that? Intense pain, visible deformity you can see. Okay, limited motion and instability, feels like it might pop again. Okay, and then nerves or blood vessels can get stretched, causing numbness or weakness. Is it fine? Then muscles affected. Fine. Entire rotator cuff stains to hold things together post reduction. Axillary nerve often irritated, weakening deltoid too. Is it fine? Okay. The causes. Okay. Causes of shoulder dislocation might be contact sports, falls on the outstretched arm, or hyperflexion, external rotation in the throwers. Is it fine? As I have told you, overhead activities, outstretched hand. Okay, this might cause you the dislocation. As you can see the picture over here, this is the normal picture, this is the dislocated picture. As you can see, the humerus is dislocated, it has pulled downwards. Is it fine? Okay. So now, next we will go to shoulder impingement. Is it fine? As we can see, there is a painful arc syndrome we can see in this. So how it happens? During arm raises, rotator cuff tendon bursa gets pinched in the narrow subacromial space, as you can see over here. Okay, and then bone spurs, hooked acromion. Okay, tight muscles or weak scapular stabilizers narrow the gap further. What happens after inflammation? What happens after shoulder impingement? That is, inflammation builds, causing the sharp pain overhead, reach painful arc 70 to 120 degrees, progressive weakness and potential tendon tears if chronic. Okay, like gears grinding in a rusty engine, as you can see that. Muscle affected, primarily the supraspinatus, initiates lift, gets squeezed first. Okay, but whole cuff fatigues. Scapular muscles like trapezius, serratus anterior fail to position bones right. Okay, causes are repetitive overhead sports, that is tennis and baseball, poor posture, that is forward head, and anatomical variations like curved acromion. I'll also show you the picture. You can see there is a painful arc syndrome from 60 to 120 degrees. Is it fine? And it is pressed in between, because of which we tend to get the pain. Is it fine? Okay, now we will go with the next common injury, that is bursitis. Fine. How it happens? Friction from repetitive arm elevation irritates the bursa. Is it fine? That is the fluid sac cushioning under the acromion. Or it flares from infection, calcium buildup, inflammation, swells it like a puffed up balloon. Is it fine? I'll show you when I'll zoom the picture. Okay, what happens after that? Constant ache, that is worse at night lying on it on the same side. Swelling limits smooth motion and overhead activities becomes torture. Untreated, it leads to frozen shoulder stiffness in further stages. Okay. Muscle affected are rotator cuff, especially supraspinatus, indirectly, as inflamed bursa presses on the tendons during movement. Okay. In this picture, you can see it is pressing, so there is inflammation over here, as you can compare it with the normal picture. This is the healthy shoulder, this is the affected one. Is it fine? Okay. Now, causes. Main causes for bursitis are impingement syndrome, companion, okay, overuse, example weightlifting, rheumatoid arthritis, or acute injury. Is it fine? Okay. So we will move forward with the next common injury, that is the labral tear. It is also called as slap lesion or Bankart injury. Okay. Is it fine? So, how it happens? Sudden traction, fall on outstretched arm, or repetitive throwing shears the labrum. Okay. Fibrocartilage rim deepening the glenoid. Is it fine? Slap, tear superiorly, that is biceps anchor, or Bankart anteriorly. Fine. As you can see in this picture, superior labral tear, that is the slap lesion, and Bankart lesion over here. Is it fine? This is the labral tear. Bankart lesion. This is the slap lesion. Is it fine? Okay. So I'll explain you how it happens. As I have told you how it happens, then what happens after that? After the lesion. Okay. Deep, vague pain, clicking, grinding sensations you will feel. Instability, that is arm feels very loose, and biceps weakens, and athletes notice velocity drop when they try to throw. Okay. Common muscles affected are biceps tendon, long head in slap lesion. Okay. Long head in slap lesion. Rotator cuff for stability. Inferior glenohumeral ligament complex weakens in Bankart. Inferior glenohumeral ligament complex weakens in Bankart. And what happens in slap? The biceps tendon. Is it fine? Okay. Causes. Overhead athletics, that is pitchers or swimmers, trauma or dislocation, or degenerative fraying with age. Is it fine? These are the common shoulder injuries, what I have explained you with some examples. Okay. Now we will go forward with the symptoms which we usually see in shoulder injuries. These are the few symptoms which are commonly observed, that is the localized shoulder pain, stiffness and immobility, restriction in the range of motion, okay, visible swelling or bruising, okay, muscle weakness and fatigue, audible clicking or popping sound. Is it fine? These are the common symptoms which we see in shoulder injuries. Okay. Now we will go forward with the causes of shoulder injuries. As I have explained with all the common shoulder injuries, but this is the generalized causes of shoulder injuries. What I'll explain you, that is overuse or repetitive motion. Overuse injuries often arise from repetitive overhead activities such as swimming, tennis or weightlifting, leading to inflammation and damage to the shoulder structures. Is it fine? Next, that is trauma or falls. Trauma from falls or accidents can lead to acute injuries like fractures, dislocations or tears in the shoulder joint and the surrounding tissue. Fine. The third one is the age-related degeneration. With age, the shoulder structure including tendons and cartilage naturally weakens and become worse susceptible to the injuries. Is it fine? Now going forward with the fourth one, that is the poor posture. Improper posture during daily activities or while working can strain shoulder muscles and joints, leading to pain and injury over time. Fine. The next one is the sports related injuries. Sports related injuries are common in contact or overhead sports where the shoulder is at risk due to high impact actions and repetitive stress. Fine. So now physical examination, as I have not explained you this in very deep, so I'll be making a video including all the examinations, all the special tests, what should be included, so you can understand that there is a shoulder injury. So I'll make another video for this. This is just a brief explanation. Okay, physical examination, imaging test, that is x-rays and MRIs, USG. Fine. So this is just a brief what I am giving you. Okay. So next we'll go with treatment options of shoulder injuries. Okay, this is just a structural approach. So this, according to the physiotherapy point of view, I'll give in a brief way with all the stages, pre-operative and post-operative also. Fine. So this is just a brief introduction or like just a thing for your treatment protocol. I'm just telling you, that is rest and ice, initial treatment to reduce inflammation and alleviate pain. Okay. Physical therapy, rehabilitation exercises to restore strength, range of motion, and okay. So this I'll explain you further in deep. Fine. Medications, okay, non-steroidal anti-inflammatory drugs to manage pain and swelling. Okay. Then injections, corticosteroids, targeted relief for inflammation in severe cases for some time. Isn't fine? Okay. Then now surgery if necessary. If necessary. Intervention for structural issues that do not respond to conservative treatment. Then the last thing for improvement of your shoulder is the surgery. Okay. Now prevention of shoulder injuries. It is just a brief thing what I have collected and just put up. That is strengthening of the shoulder muscles. Warm up with dynamic stretches. Create ergonomic workspace for your posture. Limit overhead motions. Control it in a proper and in the limit. Okay. Listen to your body's signals. Your body starts giving you signals when you start doing the same activity over regular period of time. Is it fine? So we will move forward. That will come to our conclusion on common shoulder injuries. To wrap up our shoulder injury session, students, remember this. The shoulder's gift of boundless motion is also its Achilles heel, demanding respect through smart mechanics, early detection and targeted rehab. You have now got the roadmap from rotator cuff rips and impingements to dislocations and labral drama. Okay. So understanding common shoulder injuries is essential for maintaining mobility and quality of life by being aware of the symptoms, causes and treatment options. Individuals can take proactive steps to prevent further injury and ensure optimal shoulder health. Is it fine? So now, this is just a quote what I have put up. Proper care of the shoulder today prevents pain and limitation tomorrow. Keep studying, stay curious and handle those shoulders with care. Thank you. Like, share, and subscribe. If you have any doubt and if you want me to explain it in a further way for a particular topic, so you can just put a comment or let me know. So I'll make a video. So just stay tuned for my next video. Thank you.